Have you ever really stopped to think about what's going on inside your brain when someone takes a psychotropic medication? Well, today we're going to dive deep into the science behind these incredibly powerful substances, the ones that can actually change our moods, our thoughts, and even how we see the world. So let's break down how they really work. But first, let's start with a question that honestly trips a lot of people up. Why on earth would a doctor give you something called an antidepressant if you have anxiety, or an antipsychotic for depression? I mean, at first glance, it makes zero sense, right? And that confusion, it gets right to the heart of a huge problem in how we even talk about these meds. So here's our game plan for today. First, we are going to crack the code on that whole confusing naming thing. Then we'll actually go inside the brain to see what these drugs are doing chemically. After that, we'll weigh the pros and cons, look at the very real risks of using them long term, and wrap things up by looking at the super exciting future of these treatments.
All right, first up, let's get into why the names we use for these medications are often so misleading. You see, we tend to classify them based on their history, not what they actually do. And that, thankfully, is starting to change. You know, the old way of naming these drugs is kind of like calling a car a grocery getter just because the first place anyone ever drove it was to the store. A drug that got its first approval for depression was then branded an antidepressant forever, even if we later found out it works wonders for anxiety, OCD, or even chronic pain. The new system is way smarter because it focuses on what the drug actually does under the hood. And this new, much more logical way of doing things is called Neuroscience-based Nomenclature, or NBN for short. So instead of a vague label like antipsychotic, it describes the drug's specific job. For example, a drug might be called a dopamine and serotonin receptor antagonist. All that means is it blocks those two chemicals. This kind of detail helps everyone, doctors and patients, understand exactly what the medication is designed to do.
Okay, so now that we get why the names matter, let's go a little deeper. What are these drugs actually doing inside our brains? How can a substance fundamentally change the way we think and feel? So the simplest way to think about it is this. Your brain cells are talking to each other constantly, using these little chemical messengers called neurotransmitters. Psychotropic drugs don't come in and change who you are at your core. They just act like a volume knob on that communication system, turning certain messages up or down to help bring things back into balance. And these drugs work by targeting very specific messenger systems. You've probably heard of the big ones, right? Serotonin and dopamine. But there are others, like GABA and glutamate, that play these absolutely crucial roles too. And that new naming system we were just talking about, it tells you exactly which one of these systems a drug is designed to adjust. Okay, so now we know how they work, but what's the real-world impact? This is where we run into the double-edged sword. These medications can be completely life-changing, but they also come with some pretty significant trade-offs. I mean, these medications have really become a cornerstone of modern mental health care. To give you some perspective, even way back in 1996, a whopping 77% of mental health visits in the US involved prescribing one of these drugs. The number just shows you how central they've become.
And, with that widespread use, we've seen some really positive trends in the quality of care. For instance, between 1991 and 1996, the percentage of depression treatments that actually followed the established best practice guidelines made a huge jump, from just 35% all the way up to 56%.
But here's the other edge of that sword, the side effects. They can be dramatically different from one drug to the next. In just 8 weeks, the difference in weight change between two antidepressants can be over 4 kilograms. That's almost 10 pounds. And the difference in heart rate? A staggering 21 beats per minute. These are not minor things we're talking about. So what does this actually mean for a real person? Well, let's meet Sarah. She's 32, and her absolute biggest concern is avoiding weight gain. With this kind of data, her doctor can immediately rule out certain medications and instead focus on options that are way less likely to cause that side effect, like agomelatine or sertraline. And now let's meet John. He's 44, and he already has high blood pressure. His needs? Totally different from Sarah's. For him, the number one priority is picking a drug that won't make his blood pressure worse, which right away knocks out some of the options that might have been perfectly fine for Sarah. And this really gets to the most important point of all. As psychiatric researcher Dr. Toby Pillinger puts it, this knowledge is all about empowerment. It completely changes the conversation with your doctor. It becomes a real partnership where you can make decisions together about what is truly best for your body and your life. All right, now we need to have a serious talk about the risks that can come with long-term use. And to really get this, we're going to zoom in on one famous and pretty infamous class of drugs, benzodiazepines. So, benzodiazepines, or benzos, they hit the scene in the early 60s and were seen as this miracle drug. But that honeymoon period did not last. By the 1980s, alarm bells were going off about dependence and long-term effects. You fast forward to 2007, and the official recommendation was that long-term users needed to be checked on every 3 months. The miracle had become a major concern. And here is why. For people who've been on these drugs for a long time, trying to stop can set off a really brutal withdrawal. We're not just talking about feeling unpleasant. This can involve severe physical and mental health crises, including things like memory impairment, personality changes, and even an increased risk of suicide. Now, the big question about whether they cause permanent damage is still being debated. On one side, lots of studies show that long-term use can mess with crucial cognitive functions like memory and attention. But on the other side, brain imaging studies haven't found evidence of lasting physical damage to the brain's structure. The jury's still out, which is exactly why being cautious is so important. So, with all of this complexity and risk, where are we headed? Well, let's look at the exciting future of psychotropic treatment, which is really all about getting more and more precise in every single way. This future starts with that neuroscience-based nomenclature we talked about. It's really just a simple two-step process. First, you name the messenger system, like serotonin. Second, you describe what it's doing, like reuptake inhibitor, which just means it's helping keep more serotonin active in the brain. It's simple, it's clear, and it's so much more scientific. But the innovation doesn't stop with better names. Nope. The next big frontier is delivery. Scientists are developing these total game changers for getting medication to the brain, like intranasal hydrogels that create a direct nose-to-brain highway, completely bypassing the rest of the body. And this isn't just some sci-fi idea. Preclinical studies are already showing that this hydrogel tech can get over 60% of the medication into the exact nasal regions that are needed for that direct transport to the central nervous system. I mean, think about what that could do for acute conditions like epileptic seizures or opioid overdoses where every single second counts. It's revolutionary. So what's the big takeaway here? We are entering a brand new era of precision mental health care. We're moving away from these one-size-fits-all labels and towards truly personalized treatments. The ultimate challenge, though, is going to be balancing the incredible promise of all this new science with the hard-won lessons from the past. And really, for anyone navigating this world, the goal is always the same: making an informed, empowered choice.